A solid gold crown for a molar? Well, it's almost a solid gold crown. This is a cement retained gold crown on a custom gold post on a dental implant. When it was made back in 2008, my lab tech told me it was the heaviest gold crown he ever made. Now, why did I choose to make this crown out of gold and not zirconia? Why did the patient even get a dental implant to replace a second molar? 95% of the time, my patients don't bother replacing second molars and they don't miss having them. This is one of the 5% of cases where the person needs their second molar for chewing. If you look at their bite, you can see that they have an anterior open bite and they are only touching on the last two teeth in their mouth, the second and third molars. Without that second molar, it would be difficult to chew. So why gold instead of zirconia? This implant and crown were placed in 2008. Zirconia was not available yet. The patient didn't care how the tooth looked, he just wanted the strongest material available at the time. The implant and crown have been doing great since then. Anyone watching have a gold tooth in their mouth? Let me know down in the comments.